Starting in May 2010, many Americans will start to lose their federal subsidy for COBRA health insurance. If you're losing your COBRA subsidy, here's how health reform can help you. Starting in 2014, health reform will allow consumers, regardless of their level of health, to buy private health insurance and provide subsidies to help lower-income Americans pay for their premiums when they don't get insurance from an employer. If your COBRA subsidy ends and you can't afford to continue COBRA without the subsidy, you may be able to take advantage of new and improved consumer protections for people who buy their own coverage. Here's how the new consumer protections work. There are a number of new protections that become available this year. For example, insurance companies would only be able to cancel your health insurance policy in cases of clear misrepresentation or fraud. And health reform will also require insurance companies to cover the cost of preventative care, like immunizations, without any out-of-pocket expense. Health reform also removes caps or lifetime maximums from your policy, which means there are no limits on the amount of money your insurer can spend on your health care. And beginning in 2011, insurance companies will be required to make a public disclosure if they intend to increase your monthly premiums, and provide justification for increasing the cost you pay each month to maintain coverage. If you can't qualify for private insurance because of a pre-existing medical condition, you would have to stay on COBRA for 18 months, at which time you'll have the option to buy what's called a HIPAA coverage plan. Beginning in the fall of 2010, the federal government will also be expanding access to high-risk insurance pools for people with pre-existing conditions. High-risk pools function just like private insurance. But high-risk pools are not always less expensive than COBRA or HIPAA insurance. And one of the requirements for accessing a high-risk health insurance pool is that a person must be uninsured for 6 months. Take action now. If your COBRA subsidy is ending soon, it can take weeks to get approved for a private insurance policy. And if you have a pre-existing medical condition, it may be difficult to find private health coverage that is less expensive than your COBRA prior to 2014. Be proactive and start researching your options today. Prices for health insurance are fixed by law, so you will always pay the same price for the same product, no matter where you buy it. To look at the largest variety of plans available online, go to eHealthInsurance.com or talk to a licensed eHealth insurance agent right away to discuss your options.